Hello there. So one of our newer users was asking me to make a video about health anxiety. Um, I think health anxiety definitely plays a role in tinnitus, but I wanted to cover it in a more broader sense. Um, I think sometimes we can feel powerless to understand what might be wrong with us. And we can sort of get a habit. Maybe before you have really bad health anxiety, before that, you kind of get a habit of sort of like worrying about things. I certainly had this problem in the past. I I have danced for a large part of my life, and I always wanted to make sure that my body was in the best of condition so that I, could always dance well. And often, like when I maybe my back hurt a little bit, I would start to think about, okay, what stretches do I need to do? What exercises do I need to do? Um, and like I would really think about, and I like if my back, I'd be like, okay, I've got to hold my abs in really good, and remember to hold my abs in so that my back will be strong. And maybe that's probably why my back is hurting, is because I haven't been holding my abs right. And then I would walk around all day and think, trying to always keep my abs in, and you know, and I would really, really overthink it to the point where my back hurt more because I was so focusing on, probably I was straining so much to keep the muscles strong, that like that in itself hurt my back. um, and I can remember another time I had like a pain. It was kind of near the groin area, somewhere over here, and like I became like obsessed with trying to figure out there must be something going on in this area. And like I remember I even got a massage there. It was kind of like a weird question to ask the massage therapist. Could you massage like right here? And then I'd ask him like, what do you think that might be? And then, they would tell me. I remember I would get massages a lot, actually. Another time was like around the IT band region. And, one massage therapist told me, well, I think you've got, sort of just like some tissue that I forget what the word he used, that is sort of like binding there. And you may have this problem for a long time, but you're going to have to work it out. And, maybe in time, if you're lucky, it'll get more closer to normal, but maybe you'll never be normal there. And like, I totally took those words that he gave me as the exact problem that was wrong with me. And then for the longest time, I believed I had a serious problem with my IT band. Well, years later, my IT band is totally fine. I think I did have a little problem, at one point, but I really magnified it in my brain. So I just wanted to kind of go through the process of how I got to have health anxiety, because I slowly built up in my brain this idea of turning a small problem into something that's really big in my mind. So I remember, like, even before COVID, I was getting where I had some back pain, and I was trying to jog, and I felt my back pain, and I was crying as I was running, and I just couldn't believe that I'm maybe going to have back pain for the rest of my life. I can tell you right now, my back is doing just fine. It occasionally bothers me, but I don't have any big back problems. But I believed that I did. So then, when I got COVID, I had multiple things go wrong at the same time. I got tinnitus. I had some problems with a couple of my joints, my knee and my toe. And then I had probably I had a little bit of a swollen heart, because there was one medical diagnosis that they took where they said it may be swollen. But they did like an MRI, and they also found that I might have a couple of like little, I forget what you call them. It's not like cancerous, but where maybe like some little sections near my lung where there's like a little problem there. But like a lot of people have that. It's like from when you were sick, maybe like 20 or 30 years ago, or as a child, you can get these little things, I forget what you call them. And they found that maybe a disc in my back might have a little bit of a problem. But again, it was just a little bit of a problem. But anyways, I had the tinnitus. I had some sensations in my chest. Maybe it was because of an enlarged heart, maybe not. An enlarged heart, maybe not. I had some joint problems. And I just thought that my body was just had all these problems. And I went to the emergency room a couple of times, maybe more than a couple of times, maybe 5 or 10 times. And if it wasn't the emergency room, it was like the clinic or the doctor. And, I was trying to figure out why the doctors weren't finding what was wrong with me. And of course, I was using Google to try to find out. Now, right after I got COVID, I had read that what's really important is the oxygen levels of your blood. And there's this little device you can put on your finger that will measure not only your pulse rate, but also your oxygen level. And I got one of those, and I was stuck in a room by myself for 3 weeks and nobody to talk to. And I'm watching this thing all the time. And I discovered that maybe I remember I would try to fall asleep with it on my finger. So I wanted to have it on my finger so that if I fall asleep and maybe if I got really sick and my oxygen levels were bad, if I woke up, I could check it. And then maybe if there's an emergency, I could call for help. So I was like sleeping with this thing on my finger. And then I started to realize that when I got up, my heart rate would get pretty high. Maybe like 120 or 130. And I would be a little bit afraid to stand up and walk because I was just scared my heart rate was going to get too high. So you can see what's happening here. I was totally losing it, And of course, I was studying Google. There's this thing called POTS, I believe it is, it might be POTTS, POTS, where there actually are a subset of people who when they stand up, their heart rate can get really high, and I diagnosed myself with POTS. Also, with all these chest pains, I must have diagnosed myself with at least 2 or 3 different things. Same thing with the joint pain, with the knee pain. And I was doing like some exercises every day to try to somehow beat the knee pain. And then it was the tinnitus, the sound in my ear. So I just, I was totally like so obsessed with what might be wrong with my body. So I've spent a lot of time describing it because I wanted you to feel it the way I felt it and see sort of the insanity that I had. And so you can understand how you might have maybe go through a similar thing. And of course, I was studying Google all the time. But anyways, the doctors eventually told me, you have to throw this thing away. You don't need this. You don't have anything wrong with you. And I had to have several people tell me, there is nothing wrong with you, David. But I'm like, well, what about the tinnitus? What about the sensation in my chest? What about what's going on in my joints? Why aren't you finding it? And yeah, stuff happens. Stuff happens to your body. Your body changes. But just because you have a problem, maybe even a problem that you might have to live the rest of your life with, like tinnitus, it doesn't mean there's something wrong with you. It doesn't mean like you can't live your life. And I had to have a couple of different really important people, in my life tell me, David, there's nothing wrong with you. You're okay. You're okay now. Look at you. You're strong. You can stand up and walk around and talk, and you're in great shape. You're better than average. And I didn't believe it for a while. And slowly it sunk in. There's really nothing wrong with me. I'm actually in pretty good shape. I'm in pretty good health. My blood pressure's great. Although when I was anxious and stressed, I besides having this thing on my finger, I also had the blood pressure pump, and I must have done it every 5 minutes sometimes. Like I would go maybe do it 30 or 50 times in one day. And of course, every time I checked it, my blood pressure was too high. Can you imagine why that might be? And my pulse was too high. And, so as you think about all these things, of course, it gets, but you've got to learn to trust the doctor. If you're not sure, go to the doctor and have them test you. And they'll test your heart and maybe do the CT scan, and they can check your ears, and they can tell you, look, you're not about to die. And then you just need to believe them. Believe them. There's nothing wrong with you. And you might have to tell yourself that again and again. There is nothing wrong with me. I'm going to be okay. I am okay right now. There's nothing wrong with me. And, but yeah, I was obsessed with, and no wonder I couldn't sleep. When I first got COVID, I went 5 days without being able to sleep, and then months, on average getting 3 or 4 hours of sleep, occasionally getting 5 or 6 hours, and sometimes 0, sometimes 1 or 2, but on average about 3 to 4 hours for months. And I was not in a good, place in my brain. So now I understand. I hope that I would never be in that sort of thought pattern again. But, it slowly developed where I would worry about my back hurting, and maybe I didn't go to a regular doctor and them tell me, hey, David, your back's fine. You just do some exercises maybe, but you'll be fine. But it slowly developed, and then I would worry about things. And I think maybe I had some other anxiety in my life too, and just that anxiety would sort of focus itself into me feeling pain in my body and then worrying about it. And then that piled on top of everything. So now, if my back hurts or something, I just don't even think about it. And it's almost like it's not there. I've learned to condition myself to not think about it. I do have one toe. You'll see in some of my earlier videos where I was talking about being worried about it. I was still coming out of the health anxiety back then. And I've got a toe where I may very well need surgery. Not like next week or next month, probably not next year. But I've got a swollen joint, and it may need something in the future. But I would worry about it so much before, and now it's like, look, I can dance, I can walk, I can do everything that I need to do, and yeah, maybe one day I might have to have surgery on that toe, but I'm great. I'm so lucky that I'm here making videos for you guys, and I hope you maybe appreciate my honesty of telling you exactly my delusions that I had, because I think I was reading that almost everybody at some point in their life will experience mental health issues, and I certainly did. I was just so alone and didn't know what was wrong with me, and I didn't believe the doctors for a while, and maybe I just didn't feel like I was getting the support that I needed, and I was just very alone and worried, So I think it's important to recognize how we can have these delusional thoughts, and then if you can believe the doctors when they tell you, and then, that alone, you need information. If you're worried that there might be something wrong with you, get the information, and then believe the doctor when they tell you. And if you need to get more information and ask them again, you can. It costs more money that way. But doctors are trained pretty well, because they're going to be sued if they don't, they're exposing themselves to lawsuits, and they're trained to find anything that might be, that would especially lead to things like death or a severe disability. They're trained to find that, and they're gonna be right. So, but I went through that, and I learned, and I'm better now, and I don't go around worrying anymore. I've got to live my life. I don't have time to think about that anymore. But yeah, this is quite a topic. It looks like this is one of my longer videos here. I'm at 15 minutes. But I guess you have to learn to say, there's nothing wrong with me. You know, I'm okay. And somehow find a way to believe that. Because if you can believe it, in here, then you can be past this health anxiety problem. And you may need the doctor's help. You may need some moral support from your friends. But you already know you have the problem. If you said, hey, David, can you do a video about health anxiety, right? You know you've got the problem. So you're going to stop researching. You're going to go to the doctor if you need to, and they're going to tell you, are you okay? And if they say you're okay, then I'm okay. I'm going to stop researching. I'm going to stop thinking about it. I'm not going to measure my pulse or my blood pressure. That's the doctor's job. My job is to eat healthy and do some exercises and maintain a positive mental outlook. There's nothing wrong with me. Yeah. Okay, so that's my video for today. I kind of enjoyed making this one because it helps me to sort of get some of this out of me too. I have to remember, to not go around worrying about what might be wrong with me because I've just got more important things to do. Okay, see you later. Bye-bye.